And actually, I like to take this back to thinking about what we're looking at in the chest. So this is a right lateral radiograph where we can think about the structures that we can see in the chest. And we can overlay that with a model of what our cardiac structures are. So when we open that up, we can see we've got left atrium, left ventricle, right ventricle. We can see the aorta coming off the left ventricle. And then from the right heart, we can see the cranial vena cava and caudal vena cava coming into the right atrium that we can't actually see a lot of from this side, and the right ventricle. And remember, this is a right lateral radiograph. Therefore, this is what we are seeing from the left side of the chest and what our stethoscope is going to pick up on the left side of the chest. So when we're putting our stethoscope on the left side of the chest, these are the areas we're looking at. So over the left apex, this is our mitral valve. And then at the left base, we've got our aortic and pulmonic valve, because those two vessels really wrap around each other. So it's really difficult in a cat or dog to really distinguish aorta and pulmonary artery really easily. And remember to go dorsally, and we'll talk about this a little bit more when we're talking about the left basilar murmurs, but going dorsally is still considered part of the left base, and that's where your PDAs are. And that's one of my top tips, is to remember to go dorsally with dogs, because otherwise you're going to miss some of your PDA murmurs. This is a left lateral radiograph. So again, structures that we're going to see when we're looking at the right side of the chest. Again, we've covered that with the anatomy of what we're looking at. And then cut that down so that we can see the structures. So we've got the right atrium and the right ventricle. You can see a little bit of the right ventricular outflow tract, but interestingly, notice that you can't see the aortic or pulmonic valves as nicely. The way the heart's positioned means that they're over more to the left side of the chest. Putting on our stethoscope, our right apex is covering our tricuspid valve. When we think about the right base, there's not really such an obvious valve or structure that we are covering with that right base auscultation in the same way that we have on the left base. We still listen in that area because we're listening for radiation of murmurs, but it's not an area that we consider classically to be the point of maximal intensity for most murmurs.